I'll just dive right in. I guess for some context, I'm a research fellow at the National Institute on Aging. There we go. At the National Institute on Aging, housed at Toronto Metropolitan University, formerly Ryerson University in Toronto. So I guess with that, for the sake of time and maybe having a little bit more time for questions at the end, I'll dive right in. But I'd like to start by just highlighting that the common perception kind of currently is that we as a society have never been more connected. And that's thanks to technological advancements. But a big but there's mounting research that suggests that being alone is one of the most pressing and growing concerns facing modern society. And in fact, social isolation and loneliness are increasingly becoming recognized as an important public health concern that needs to be addressed, as it carries significant implications for the health and well-being of Canadians of all ages, and particularly for older Canadians, which will be the focus of my talk here today. And so, as we can recognize that the proportions of older adults in Canada are growing rapidly. So by 2031, it's anticipated that people aged 65 and older are going to be comprising about a quarter of our population. And as we can expect and also anticipate, the number of those who are either isolated or lonely is also expected to increase, meaning that both the social and individual consequences of loneliness and social isolation are also on the rise, right? So, but the challenge here is that there's gaps in our data, there's inconsistency in the variables that are used to measure social isolation and loneliness. So we don't really have a solid sense of the prevalence. And just to give you kind of a sense of the range of numbers that are out there, research shows that about 30% of older Canadians are at risk of becoming socially isolated. And when in terms of loneliness, Stats Can estimates that between 19 and 24% of Canadians age 65 and older wish they could participate in more activities. And overall, we can see numbers that range anywhere from 6% to 43% when it comes to folks in community who feel socially isolated, where about 10 to 50% report feeling lonely. So after throwing out all those percentages, it's easy to see how it's difficult to really get a true sense of the issue, even though we know that it is quite pervasive, based on anecdotal evidence. And so you may be picking up on that one of the major reasons why there's this lack of consensus is that there's a tendency to use the term social isolation and loneliness interchangeably. It makes it hard to distinguish between the unique aspects, and also the interrelated aspects. But for the purposes of kind of the work that we do and our conversation today, we'll specifically define social isolation as the measurable lack of contact, family or friends, that quantitatively diminished social network, or being physically separated or excluded, while loneliness is more of that subjective experience arising from the qualitative and quantitative deficits in a person's social relationships. So the feeling that one's social relationships are lacking in quality and quantity compared to what they desire. So to really highlight kind of the challenges here, while the concepts, and we define them as distinct, there's also aspects that account for different ways that individuals experience their social context and how they've both been consistently identified as detrimental to one's overall health and well-being. And so kind of despite this distinction, as I've kind of tried to make that point that they're distinct, there's also similarities in the predisposing factors, modifiers, and outcomes related to social isolation that I think, and this suggests that there's also likely a commonality among the types of interventions that can be used to target and address social isolation and loneliness. So we'll get a little bit of a sense of that now. So when it comes to older adults, they're at a higher risk of experiencing social isolation and loneliness for a number of reasons, and the majority of which are out of their individual control. So things like growing geographic mobility of family members, meaning that older adults are more likely to be separated from their families than in past generations, and may have fewer opportunities to meet new people, due to their geographic location. And some of the additional considerations include accessibility and transportation issues, particularly in rural communities where loss of one's driver's license or the ability to drive is often associated with social isolation as well. Some sociodemographic characteristics have also been linked to increased social isolation and loneliness. So, for example, loneliness has been found to be more common in older members of immigrant populations where the language and culture in their destination country differs significantly from their country of origin. The National Seniors Council report on social isolation of seniors found that 2S LGBTQIA+ older adults report less social support and more loneliness. And interviews with folks have also emphasized that we need to pay attention to the relationship between poverty, inequity, and disadvantage, and also social isolation. So there's a lot of those sociodemographic characteristics that also come into play. And I think it's also been suggested that kind of our reduced social participation in older folks is linked to fears about engaging in social opportunities, so things that stem from fears of social rejection. There's also a factor of where internalized ageism becomes a self-fulfilling prophecy, where kind of the stereotypes and the expectations that society places and portrays for older adults related to being lonely in older age kind of becomes that self-fulfilling prophecy, as I said, and with higher reports of loneliness in later life. And then also critical life transitions such as retirement, death of a spouse, family, or friends, as well as social participation due to declining physical health, also play a factor here. And so highlighting the complexity of interactions between personal circumstances, comorbidities, and social connections, we see in the research that there's an association between social isolation and poor health behaviors and adverse health outcomes. So when I say poor health behaviors, that includes things like smoking, alcohol consumption, poor sleep, and physical activity, whereas adverse health outcomes include cardiovascular disease, depression, anxiety, dementia, frailty, and increased functional decline, as well as an increased risk of elder abuse. However, I think one of the potentially most concerning outcomes is associated with social isolation and loneliness is that increased risk of premature mortality that is comparable with other well-established risk factors like lack of physical activity or obesity or injury and violence or a lack of access to healthcare. So that's quite striking there. And to bring in the COVID lens in Canada, the COVID-19 pandemic also brought more public attention to social isolation and loneliness in older adults. So the widespread mandates to reduce in-person contacts, avoid leaving the home, kind of the no visitor policies in long-term care and retirement communities, subsequently kind of are linked to a rise in social isolation and loneliness and among our older population. So we can see the direct links there. But it also highlighted and work that we did with TELUS Health kind of showed that also younger folks were reporting increased feelings of social isolation and loneliness throughout the COVID-19 pandemic. And why that's relevant and concerning is that with an increasingly higher baseline of social isolation and loneliness as people age, it further increases the proportion of older adults impacted by that lack of social participation, by that feeling of loneliness associated with having smaller social networks. And that kind of further compounds the issue when it comes to later life and aging as well. And so to the extent that social isolation and loneliness put individuals at risk for health problems. There are some things that are important for buffering the negative consequences. So studies have shown that specifically among older adults, women, those who are married or partnered, or do not necessarily live alone, that have better visual and hearing abilities are less likely to experience social isolation. A longer length of residence in a community and participation in community or religious events have also been shown to decrease rates of social isolation. Social inclusion and the presence of positive social supports can lead to more self-satisfaction and social engagement, and may prevent experiencing functional decline. And a preserved level of physical functioning that's is associated with improved frequency of contact with friends and family. And so overall, you can see that there's value in maintaining interpersonal relationships with increasing age, as it appears to really contribute positively to well-being and improve the overall quality of life when it comes to older Canadians. And so kind of beyond individual and community level protective factors, there are many different types of initiatives and interventions that have the potential to alleviate social isolation and loneliness among older people. So generally things like personal contact, as I mentioned, education activities, exercise, social activities, skills courses, radio programming or support or discussion groups, so things like that. But the caveat there is that existing literature also demonstrates that lonely folks are often unaware of what's available to them in their neighborhoods, and are concerned potentially with the stigma associated with being lonely, so aren't seeking out resources for that, and may have a negative view of social groups that are kind of unstructured and more social in nature. Kind of the question of what's the point, essentially. So to address this, there are 4 general principles that can be useful in the development of interventions when we're thinking about combating social isolation and loneliness. So number 1, leveraging existing community resources, and some examples I'll mention in the coming slides for concrete examples of what that looks like. Designing to be inclusive and socially and culturally appropriate and safe to meet the needs of specific populations. So thinking about 2S LGBTQIA+ communities or racialized or ethnocultural communities, working to include older people themselves in the design, planning, and execution and evaluation of certain interventions. And also being really considerate of factors relating to access. So things like physical environment, financial limitations, transportation, and digital connectedness. So as I mentioned, I would get to some concrete examples. So within Canada, there are a number of Canadian examples that may be useful for you all. So in BC, the government is supporting improved transportation services for seniors to help maintain meaningful social connections and independence. So that's being done through the purchase of buses and vans and other improvements to existing transportation services. In Nova Scotia, similar idea in terms of shifting kind of the narrative around aging. So really focusing on supporting aging in place, being connected to community life, and really bringing older adults into our communities. The government of Ontario has funding for over 300 senior active living centers, so a community hub for seniors and older adults. The government in Quebec is once again promoting active aging and working to facilitate ongoing participation and social inclusion. And kind of at the more community level or the local level, in Hamilton, Ontario, there was a study done to connect seniors with existing supports in their neighborhoods. So helping folks, number 1, realize what's out there, and number 2, how to connect to it. In Ottawa and across the country, there's a program called Senior Centers Without Walls, which is a telephone-based program to facilitate connection beyond one's immediate network. And so there are examples of initiatives that are popping up across Canada and also across the world, as we'll see. But what is kind of lacking at the moment is any longevity. It seems to be reactive approaches that, number one, don't necessarily have funding to be sustainable in the long term, or don't have, or are volunteer driven in a sense where once again the longevity and maintenance of those programs is challenging. And then beyond Canada, as I alluded to, countries like the UK, Australia, Japan, and the US have traditionally been more proactive in developing strategies to support older adults when it comes to social isolation and loneliness. So in the UK, they've appointed a minister of loneliness, and I've also, as part of their outreach and advocacy around social isolation and loneliness. So they have a number of programs for outreach and a national calling service. They have befriending services. That's a tough one to get out. And also IT training. So in enhancing digital literacy for seniors across the country. Australia has a public awareness campaign through their Coalition to End Loneliness. So they're working to integrate universities, nonprofit organizations and agencies, and community volunteers, and leveraging those resources to support seniors across the country. Japan, we see it's notable for being a country that's experiencing kind of that most accelerated rate of aging. And so in response, they've kind of integrated and kind of come up with a basic act for measures for an aging society. So it outlines the integration of older Japanese persons and objectives for ensuring that there's opportunity to participate throughout the lifespan, whether it's social activities or work activities. In the US, we see the senior corps, where the network of national programs and services to support the volunteer activity of folks who are older than the age of 55, to foster civic engagement and improve community relationships. So there's a number of approaches that we can pull from when we're trying to think through what we can do in Canada to address social isolation and loneliness. And so I think what becomes clear, at least in our work, is the need for a comprehensive and balanced approach. Our organization calls on the federal government and federal leadership to kind of develop a national strategy to address social isolation and loneliness. But so we have a number of policy recommendations, but just quickly to kind of wrap up my time here with you all today, I'd like to highlight, we have 6 overarching policy recommendations, but a couple may be particularly relevant to keep in mind as you all are moving forward with your work. And I think when it comes to social isolation and loneliness, we need to continually work to raise awareness, to destigmatize and promote best practices for older Canadians who are experiencing or at risk of experiencing social isolation. So that awareness piece being a prerequisite to discussions and collaborative efforts. Awareness, we've seen it across a number of social issues, is kind of a linchpin when it comes to combating stigma, and also being an important component of emphasizing valuable roles that older Canadians play in society. So whether that's through volunteer or mentorship or community participation and entrepreneurship. So that awareness raising, is key. And also public awareness can also prompt individuals to have identified their own kind of concerns relating their level of social connection. So by raising kind of public and provider awareness about the risks of social isolation and calling attention to those things that are quite alarming, whether it's premature mortality or the long-standing impact of social isolation and loneliness, I think we can move our either local, our municipal, provincial, or federal governments to do work, or our local organizations to take an active role in supporting older people in a much more meaningful way. I think one of the challenges we highlighted is that longevity. So I think being able to build the collective capacity of organizations to address social isolation. So we see programs kind of popping up, but there's a little bit of redundancy in terms of what types of programming is offered. So if we can kind of come together, build that collective capacity and consolidate between organizations, I think that there is some really valuable interventions to be found there. So there's that idea. So for example, from COVID, I think we saw a lot of organizations that were offering in-person supports for folks shifted to telephone-based interventions, which also expands kind of their ability to connect, number one, with the older adults that they're already connected with, but potentially more folks who may have not been able to reach programming due to accessibility issues, for example. And then finally, I think it goes without saying, but prioritizing that accessibility, the equity, I guess, and inclusion-based approaches is critical to appropriately counter and prevent, I think, the consequences of social isolation and loneliness. So participating in programming and engaging with community organization and requires that varying needs, capacities, and resources for older adults are reflected in how they're designed and delivered. So working with and for older adults with various interconnecting social identities, I think, is really important in order to create the best and most meaningful ways to address concerns around social isolation and loneliness. So with that, I'll open the floor a little bit and stop talking for a second.
Dr. Flanagan, would you mind turning off your screen share? Because I think we're going to have people pop in and ask questions. This was really interesting, especially interesting for me because I've been back home to Ontario to deal with my aging parents who are all over 80. My dad has bad hearing and he's experienced all these declines, and I had to go in and fix the bus. And I basically saw this chart in a place called Hearing Life. And it basically says if you can't hear, all of a sudden your social isolation is like one of the biggest issues you end up facing. And amongst all sorts of things like falling, heart issues, increased risk of heart disease, amongst a host of all sorts of other things, dementia. And so I was like, Dad, are you wearing your hearing aids? He's like, well, no. I'm like, well, why? Well, they're not really working. Well, how long has this been going on for? I don't know, since last September. I'm like, oh my God. So with that, I'm wondering, of all the different things going on here, this sounds unbelievably complex, unbelievably difficult. But how can this group act in a way that might be the most powerful, or give the most powerful impact? Because a lot of what I see there is kind of like high level strategic planning, and then it filters down. This group is going to do a little more tactical. They're going to create a little strategy, but they're doing something that's going to act and just start address things. And so I wonder, like, what is that thing that's going to help them? And folks, if anybody else has questions, please pop them in the chat. And we just got a few minutes.
Yeah, I think, yeah, like as a national organization, obviously our approaches are a little bit more high level and in terms of government advocacy and programming and policy that way. But I think if I think about the older adults that I engage with on a day-to-day basis, I think number one, for folks to have an awareness of what older people are facing at the moment. And so whether this concern right now is social isolation that we're talking about here today. So taking the time to chat with folks, kind of creating, maybe there's a way to create a way to foster connection, whether it's intergenerational connection, I think, in bridging that the divide that I think has only become kind of more expansive thanks to COVID between younger generations and older generations. I think kind of combating the sentiment that COVID was, quote unquote, a boomer remover in the sense, and combating that stigma that's associated with aging and what needs to be prioritized when it comes to our social safety net, et cetera, and things like that. So there is a lot of intergenerational connection that could be fostered. And I think that there's some neat ways that companies can create platforms, digital platforms for fostering connection, hearing people's stories, sharing stories, coming together in a way that is that helps bridge that divide that I think that, and that we see as an organization that's only becoming a bigger in a sense. So
I'm gonna kick this to Benson has a question, and Benson, if you want to jump in on that, and then I see Carrie. If we can do a real quick question, and Dr. Flanagan, you're gonna have to go really fast with an answer. Whatever comes to mind, please go for it. Benson, go for it.
Sure. Yeah, Dr. Flanagan, thank you so much for your discussion earlier. My question is, it seems like the protective factors society deems to be like a normal person. So how do you think people with a more traditional mindset can break down some of these perceptual barriers and have that sense of inclusion?
I think that's probably one of the number one issues when we talk about breaking down the stigma and breaking down the barriers, and who we think is number one, valuable in our society, and number two, who we are going to choose to support. And so historically, you're right, a lot of what we deem as protective for aging or for condition or for issues of social isolation are what we prioritize in society as quote unquote normal. And so I think we need to expand our understandings of how we come together and build that collective capacity to support people. So a lot of what has been done is a very individual focused. It's on you to solve your problem. But I think that there is so much more value and so much more meaning in kind of building that community and taking a community-based approach and taking that onus to facilitate that and to build connections, as I was mentioning early. So kind of taking it from an individual perspective to a collective perspective, I think is one of the ways that we can potentially start to break down that mindset and to better support each other.
Awesome. Carrie, do you want to jump in? A quick question?
Yeah, of course. I love the topic. Thank you so much for that. I was kind of curious also when it comes to the approach, how are we able to account maybe culture to it? I know that, for example, my background will be Latin America, and my parents and my dad, to be more specific, very different, doesn't talk that much, doesn't socialize that much with people compared to my mom. So I don't know what is maybe some of the factors that you might want to include, or just even mention that can account culture as well.
Yeah, I think that and culture number one, and the different cultural approaches to supporting our older generations is also widespread, and the work that we do obviously has a very specific and Eurocentric approach where we don't necessarily see our older generations as kind of mentors and elders and supportive and in that way. But I think that absolutely culture plays a role in it, and also our personalities. So some folks may want to be connected with so many different, and they thrive on that social interaction, where someone who has fewer connections or is more closely connected to their family and their immediate loved ones, and the approaches are very different. And I think that it's part of the complexity of the issue is how do we best support folks in an individualistic way, but also in a consistent way that holds the most value for the most people. So I take your point for sure that there's so many factors to consider when it comes to supporting folks.
Awesome. Dr. Flanagan, thank you so much. This is like super fascinating, very timely for me personally. You know what?